be bringing your head and neck in a variety of positions. For the special test, it will require me to place my hands around your neck, possibly your upper back and shoulders, and definitely around your head as well too. So with the special test, we might possibly recreate some discomfort for you. You might get some dizziness, some nauseousness, and you might experience some discomfort. So if you do experience discomfort, please let me know. But this will give me information to develop an appropriate treatment plan for you. And the purpose of the special test really is just to assess the integrity of the blood flow to your brain. All right? Do you have any questions about the special test so far? Perfect. I'll get you to please lay down on your back on the table with your head at this end, and I will wash my hands. All right, so first thing to keep in mind with this special test, you need to have your patient's eyes open for the entire duration of this special test. All right, reason being is because one of the positives for this special test is called nystagmus. It is on the screen for those of you who want to know how that word is spelled. Okay, nystagmus is defined as a rapid eye movement from side to side. Some people, they have fluttery eyelids. That is not nystagmus. It is the rapid side-to-side movement of the actual eyeball. That is defined as nystagmus. Okay? So for this special test, well, an indication of the special test is your patient described that they had been in a previous motor vehicle accident. They are experiencing chronic lightheadedness. Yeah, that's pretty much it. Chronic lightheadedness, or they described that they were in a previous MVA, and you want to test for safety. All right, so Byron, I'm going to get you I'm going to support your neck first. I'll get you to go ahead and bring yourself towards me so that your head is off the table, to your shoulders. Perfect. All right, I'm going to start slowly lowering your head, and please let me know if you experience any nauseousness, dizziness, or if you need to stop anything, okay? When I'm dropping your head back, I'll just get you to keep your eyes open for me, all right? All right. Nice and gentle. If you want to be super, super, like, astute, you can be like, okay, what year is it?
2024.
Good job. Okay, what city are we in?
Barnaby.
Nice. Awesome. Any dizziness? Doing okay?
Yep.
Good. Okay, once he's in full extension, we are going to go ahead and bring him into lateral flexion to the unaffected side. So if he was complaining about numbness and tingling on one side, I would go to the opposite side. So we bring him over into lateral flexion. Good. What class are we in right now?
Cervical.
Great. He's doing good. He's doing good. Good. Still okay?
Yep.
Good. All right. And then we're going to bring him over this way. Full rotation as far as you can go. Okay. And what day of the week is it?
On Monday.
Perfect. All right. Now I'm going to slowly bring him back up. And for the purposes of your OPs, you will probably be asked to only assess one side, but make sure you tell your examiner that I would assess bilaterally, test the unaffected side first, but for the purposes of time, I'm going to only perform this special test on one side. Right? All right. Go ahead and move down on the table. So we start with extension, then we do lateral flexion, and then we do rotation. Now the vertebral artery that you're testing with this special test is the contralateral vertebral artery. So I was laterally flexing and turning his head towards the right. That means this special test was meant to test the left vertebral artery. Okay? Which means how much rotation minimum is necessary in order to affect that contralateral vertebral artery? 50. 45 degrees is the ipsilateral vertebral artery. Contralateral vertebral artery is 50 degrees, and that is what this special test is testing. To be specific, it is the contralateral vertebral artery, not just vertebral artery. All right? All right, any questions about that one? Okay, indication is patient complains of previous MVA, chronic lightheadedness, etc., etc. Tissues being stressed. For this one is the contralateral vertebral artery. And indication, already that. A positive sign or symptoms would be dizziness, nauseousness, nystagmus, forgetfulness, cognitive decline. When asking all the questions, they might answer questions wrong, et cetera, et cetera. And they need to be easy questions, not like who's the 22nd president of the United States and stuff like that. Right? Make it general questions. Right? So, any questions about that one?
What happens if they become unconscious?
That's not good. You do not continue with assessment.
You just hold your head there?
No, you'd probably want to get you can put a chair or something to hold him on there to be able to attend to him. But odds are you would catch signs that would be a risk a lot earlier on.
So you get dizzy or something?
Yes, exactly. Like they can't even move, they can't even get up from laying down and stuff, right? Yeah. So with this special test, keep in mind that, hang on, there was something I wanted to say and I totally forgot what it was. Sorry, 1 second. Right. So as with all special tests, this has multiple components. Extension, are you okay? Great. Lateral flexion, are you okay? Great. Rotation, are you okay? Great. If he tests positive just as I'm dropping into extension, do I have to go to the other ones?
No.
No. Do not go to the other ones. All right? It is considered a risk of harm if you do. The thing about this special test is if you are going to find somebody test positive, they 90% of the time test positive very quickly. Very quickly. Like it's usually in extension. You don't often have to go into the other ones. All right, so just be very, very careful, especially when dropping the head and making sure their eyes are open, but just know that usually a positive for the special test happens very quickly. Okay? Any other questions? You, for OP's sake, you just say, oh, and that tested positive, we'll get it back on the table, and then you just verbalize to your examiner what you would do in circumstances where your patient didn't test positive right away. Because we want to know if you know how to perform the full special test from start to finish. Yeah. Good question. Okay, we'll do Ben first.
So if they didn't get their right side, you would put their neck over to the left side and test this side?
Correct. But second.
Yeah, I was just saying you test the.
Yes, so if they're complaint side, this is like, don't get confused with this, and I'm about to confuse you even more, I'm sorry. So because we're testing the contralateral vertebral artery, if they are complaining about sensations on the right hand side, counterintuitively, you have to bring the head to the right hand side first because it's assessing the other side. Does that make sense? Okay. Good question. All right, any other questions about that? Beautiful. All right, so now we've got the cervical flexion rotation tests. Oh yeah, sorry.
Can you do that to someone with vertigo?
It depends on a couple factors. Do they know why they have vertigo? Is it controlled? What's the cause of that vertigo? And honestly, this would actually probably be an effective special test for you to perform to assess how severely their vertigo could influence your treatment. Right? Because some people can have vertigo, but it's like super, super minor. But then we have individuals who have vertigo where you have to like literally help them off the table. Right? So this is a good, we're not seeking a positive because it will probably test positive, but how quickly are they responsive to that positive? So you still gain information. Make sense? Yeah. Good? All right. So cervical flexion rotation test. The purpose of this special test is to be able to isolate and identify where restriction in rotation is. So essentially you're going to do your range of motion assessment and you notice that, oh, they can turn their head way more towards one side than they can towards the other. Well, the purpose of the cervical flexion rotation test is to see if that restriction is taking place in the capital C-spine or if it's in the rest of the C-spine. Okay? So indication is you would notice during their range of motion assessment that they have more rotation from one side towards the other, and the purpose is to assess to see if that restriction is taking place in the upper portion of the neck. Okay? So cervical flexion rotation test. You're going to take your patient up into full C-spine flexion with capital flexion. Okay? From here, ooh, actually, you know what, Byron, I did do consent for this one. I only did consent for the other one. Apologies. So we're going to be moving on to a movement special test because we did notice that you have a decrease in range of motion in rotation in your neck towards the right side. So we are going to be assessing to see where that restriction might be. For the special test, I am going to have to place my hands around your head, possibly around the back of your neck and the top of your head, and bring you into full flexion. And then I'm going to just be turning your head in place. Purpose of this, as I mentioned, is just assess where the restriction in rotation is. But there's a chance we might experience some discomfort, so if you need me to stop or anything, you just let me know and we'll modify. But hopefully I'll be able to gain information that will help me develop the right treatment plan for you. Do you have any questions about all that? Can I have permission to continue? Perfect, thank you. Alright, so as I mentioned, full C-spine flexion, followed by capital flexion. From here, you are going to turn their head in full flexion, and you should only get about 45 degrees. Okay, if you end up with less than 45 degrees, you found your restriction. If you get more than 45 degrees, you have not got full flexion. Okay, so with full flexion, you should only be able to go to 45 degrees. If all of a sudden you're like, oh my God, we keep going, that means you're dropping yourself out of flexion. Okay, so less than 45 degrees equals restriction, aka positive for this special test. If you get more than 45 degrees, do it again because you did it wrong. All right? All right. And then so it would be a positive for the restriction being in the upper C-spine, most likely C1, C2, because that is our primary segment of rotation of the upper C-spine. And positive is restriction in motion. The tissues being stressed is the ligamentous structures of the capital components of the neck. Make sense? All right. Any questions about that special test? Okay, so as I mentioned, these two are very, very easy, so we'll just practice them after the lunch break, all right? All right, folks, if nobody has any questions,